providers across the state are trying to do really creative things to make sure that there's easy access. We're doing telephone services, we're doing televideo services, we're doing in-person services, we're doing small groups when that's feasible and appropriate. But we're just trying to make sure that if people need support, that they've got it. We're seeing crisis line numbers surge. People are calling crisis line about 20% more than they ever have in the past, and that kind of goes up and down. And we see people coming into crisis much more frequently. And our involuntary psychiatric hospitalizations, which is our barometer of how bad things are really getting in our office, has gone up about 20% to 30% each month over the last few months, year over year compared to last year. So this last month, we were up almost 30%. And we've seen the number of people just from September to October, the amount of service we delivered increased by about 16%. So I think what that tells us is that folks are struggling, that they don't necessarily have the tools to navigate this challenging world. I'm sure none of us feel like we have any extra stress at all, but you know, all the people around our community are being impacted in various ways by this whole situation. And then we add on the conflict around the presidential election, and people have really strong feelings, typically one direction or the other. And folks are having a difficult time coming together around conversation around that, and that's increasing stress. And then we've had all of this social political justice occurrences throughout our nation, and people are watching that on the news or participating in that, and that's adding to stress. Even if people feel really passionate and good about where they're at and what they're doing to try to impact those things, it adds to the overall stress level. And so we're trying to take any opportunity we can to encourage people to do those little things that help take care of yourself, to go for a walk during the day, get outside for 10 minutes a day. Is everybody really good about that? Yeah. Okay, Scott is. He's got it taken care of. But a lot of people don't. They're sitting in front of their TV 24 hours a day right now, watching the election news and the COVID news and just absorbing themselves in that. And it's not healthy. It's not helpful. It's important to drink lots of water, get good sleep at night, do those basic self-care things. Find the things that bring you joy and make sure you're finding a way just to full experience that. We've just seen a really tough year, and you know, we talk about it at the office a lot. Sometimes we talk about it feels like a double week, like we've done double hours this week. Zoom meetings, you guys are all enjoying this. It's a new skill for many of us, and what we find is it takes a lot more attention to really be present when we're not face to face with people. We pick up a lot of cues just from being in the same space with people, reading body language. And so all of this is just continuing to add stress to our lives. But I will say we found people are finding that they have skills they had no idea. All of those parents figuring out how to educate their kids. Wow, how amazing is that? Trying to keep your kids on track with everything else that's going on. And we see people engaging in small acts of kindness here and there, and it continues to promote hope. And it's those little things, I think, that sometimes add up and keep people on the steady and keep people moving forward. I think, you know, one of the populations that people don't think about are retired folks. And I know that some retirees are really active and engaged in their community, and COVID really put a stop to a lot of that socialization and activities. So it's important for people to continue to find ways to connect with the people that they care about, with their community. When we just sit on our own, we tend to struggle with the sense of value and what am I doing here? And we're seeing depression start to increase in some of our retired population as well. And they're a population that are not as likely to reach out for help. And it's been more challenging. Their health insurance often doesn't cover the care that they need. So we've worked really hard locally, and Rebecca's been writing grants like mad to make sure that we have the funds to provide care to everybody, no matter what, when they need it, because we're just seeing a lot of people that maybe we wouldn't normally see. And that's saying a lot, because we already see about 5% of the people in our little area that we serve on an annual basis. So we see about 3,000 community members, friends and neighbors each year. And I anticipate that that number is, certainly ratcheting up this year. And, we see that it's going to be a hard winter. The state is predicting, Mark, you can cover your ears, that suicides are likely to surge in November of this year based on models of other disasters that have happened, educated guesses, and they've been pretty good on their predictions. And in Clallam County, we unfortunately have a really challenging issue around trying to reach those people. In most cases, they're not folks that have come into contact with behavioral health providers or even often primary care providers. But we're reaching out and trying to educate people about how to watch for signs and symptoms, how to support one another, and again, how to just take care of themselves. From an employer standpoint, we've also taken some opportunities to talk to employers in the community about supporting your staff. I hear a lot of, I can't let my staff take vacation because we can't stop operations. And I tell people, you have to. You have to encourage people to take time for themselves and to be well, or the moment when you need them most, they're not going to be able to be there. We're encouraging employers to be as flexible as they can. And it's really hard when employers are still operating at full capacity or beyond to allow employees to have that extra space. But we find that, it's an investment in the future, because this whole pandemic business, it's a marathon, not a sprint. And I would not be surprised if we're still in some state of pandemic related decrease in activity even this time next year. The rollout of vaccine and all of that will be interesting to see how that actually happens, and whether or not people will participate in that is yet to be seen. So I think we have a long road ahead of us, but I think we have a strong community, and I think we have a community of people who care about each other and want to care for each other. And so those little acts of kindness, encouraging people to reach out either to a crisis line or a listing line or to the behavioral health center, is really a gift you can give somebody that you see that you care about that may be struggling. And I'm going to stop talking, because those of you who know me know I can go on and give an opportunity for Rebecca to say more or for folks to ask questions.
Thanks, Wendy. I'm going to kill my camera because it'll be easier on your eyes, but also my bandwidth, it's sometimes a little bit hard. So I told you she was brilliant, which she is. I think we really want to spend some time just doing, questions and answers from you guys, but let me just kick off a little bit of my experience, if that helps. I have never seen, we're up to about 150 staff at the agency, and people are working so hard, and it's an exhausting job. And I don't know, I think about 3 or 4 weeks ago, I was just completely spent. I was that, that metal on the eraser on the paper cutting through. And Wendy came in, and I think I was getting a little bit teary-eyed, and I can't take any time off right now because I'm training somebody new and writing 5 grants this month. But Wendy and I came up with a plan. And one of that was for me to just start coming in at 10 o'clock in the morning. And I'll tell you, I usually come in way before 10 o'clock, but having that pressure off really helped a lot. And so it was even doing some of those little workarounds that really mattered to me and made a difference. I will say my parents are down in the gorge. My dad's, Henry would like to talk now. I'm so sorry. My dad's 88, mom's 78. And I did not realize until my mom called me last weekend in tears, because my dad actually thought that he was dying and from a lung thing, and had gone to the extreme of trying to get together 3 doctors that would help him with, death with dignity at the end. And it was just really hard for me to hear that they were in that kind of pain. They've, since then talked to their doctors, and I am encouraging my father to seek out some help. He needs help beyond what my mom and I can provide for him. I will say for you guys in Clallam County that PBH is open for everybody. And if you are ever nervous about knowing somebody that works at PBH or something like that, if you're calling in for services, let them know that you just want things to be very confidential, and they will lock down the files. Wendy might be able to speak a little. Obviously, we're confidential with everybody, but beyond you and your therapist, nobody needs to know that you're coming in. So that's a little bit about, where I have been. Again, reminding everybody, like Wendy said, that it is a marathon and not a sprint. And, I've gone through that time that was walking very slowly for a minute, but I'm kind of back up to pace now. So we would love to hear from you guys if you've got questions. I'm sure, for Wendy, or comments.
I have a question. This is Laurel. I would like one or both of you to talk about how you're working with the county health department on various things.
So Laurel, we are in at least weekly, and for a while.
I can also get my dogs on the camera, so that would be fun.
We're in constant contact with Allison Unthanked, our public health officer.
Go ahead, Laurel.
Oh, I've got some serious delay going on. So we're in constant contact with Dr. Unthanked, and especially in the early months, we were also in constant contact with EOC. We were the Emergency Operations Center. So we were either attending or listening online to the Emergency Operations Center briefings on an ongoing basis. And we have, we're struggling because we are considered healthcare workers, and we have to treat every illness as though it could be COVID, and it's having a lot of impact on our workforce as well. So we're working incredibly closely with public health. And I've also got a strong working relationship with Tom Locke, who's the public health officer in Jefferson County. And I'm getting constant information from Tom as well as Dr. Unthanked. So it's a challenging time. We're really trying to promote flu vaccine right now with our client population. Our staff all vaccinate because we have to protect those vulnerable people. And we're also trying to help mitigate other illness coming into our building because it's imperative that we keep our workforce as healthy as possible. But this time of year, that gets really tough.
Thank you.
There's and hopefully somebody more knowledgeable than me on the call, the Clallam County Resiliency Program is working with the county, with the health department and many other entities. Tyler, maybe you can help here. They're creating tiny videos about how people can cope with not just abuse and childhood abuse, ACEs, but with all sorts of stress. And Dr. Unthanked did one, and she had her daughter, and she was just talking about taking a moment to breathe to get through periods. So those are available online, and if somebody can share that site, they're awesome.
Great. Yeah, one of our staff is involved in the resiliency project as well. Thanks, Kathy.
This morning, this is Norm, and this morning, my wife actually sent me to this, but it was an essay that our daughter wrote, and she works at Yale. And so I just opened it up, and there's a whole series of articles, and I just wanted to pass along the website information because it looked like they would be pretty good. It's called Seeking the Light, Notes on Hope. And I guess as you were reflecting earlier, Wendy, that this is a time of a lot of stress and people need hope. And it looks like every one of the different essays and articles in here is on that theme. So it may be a resource, if nothing else, just a place to go. And the site is, we can get this right. Go back to it.
Oh, you could copy that link and paste it in the chat box, Norm.
I'll try and do that too, yeah. But just to read it out, it's reflections, all one word, .yale.edu. And yeah, and I'll write that into the chat room too. But yeah, there's a whole series of articles and they look like they're pretty good. And, not just to be bragging up my daughter, but there's a lot of good writers in there. So we can all use hope and we can get it wherever it may come.
Well, we can all use hope. And that's why a couple of years ago, we changed our tagline to Hope Starts Here. And I actually challenge each of you that this time is an opportunity for you to make a difference in somebody else's life. Doesn't have to be big grand gestures, but those small things that we can do for those people that we care about, the small ways we can show we care, dropping a note in the mail, getting something in the mail that's not a bill still brings great joy to people. So even if you're not nearby a loved one, there's some simple ways to make them feel connected and make them feel cared about. And those little things add up right now. And they are so valuable. And it's incumbent on each of us who is reasonably well, I like to think reasonably well these days, to give a little to our colleagues, to our friends, to our family members, to somebody that we know is hitting a bump in the road, because it is going to be a long and bumpy road, friends.
So Wendy or Rebecca, just fantastic. It's a fantastic topic, obviously, for the times of the day. And as Rotarians, we're all focused on service. So undoubtedly, your organization is working overtime with everybody. Is there, as Rotarians, is there any service opportunities that we could help out with your organization or things that we could do as Rotarians?
Rebecca's going to ponder that. I can see it on her face. She's good at coming up with ways that people can support us.
Well, okay, so of course, I'm actually, sorry, the dogs. Part of another organization, the Olympic Peninsula Healthy Communities Coalition. And this came from them, not me, that they are actually going to be honoring all the behavioral health care workers in Clallam County on Giving Tuesday in just some small way. I think if in some way you wanted to even, I don't know, just say thank you to the agency in a letter or something that we could read to staff to know that our community actually supports them, it would mean a great deal. Because of our privacy issues and all of that, we don't really do a lot of, volunteerism. But we are happy to let staff know. Go ahead.
I was just going to say that, we, through this whole thing, we've seen shout outs.
Go ahead, Wendy.
Other healthcare workers to, our doctors and nurses, of course, our law enforcement, to our grocery workers and gas station attendants, but nobody ever thinks about those behavioral health folks who are quietly behind the scenes supporting our communities to be a healthy place. So I'm with Rebecca, those kind words of thank you and acknowledgement that we do make a difference. Because what happens is when we do our job really well, people just disappear. They go out and they live fruitful lives and they don't look back at the behavioral health center, at the mental health providers that have provided them care. So any words of encouragement or thanks or acknowledgement that the work that they do is important goes a long way with our staff, because they receive very little of it outside the organization. So that said, I will say that EDC recognized PBH this year as the nonprofit of the year, and that was huge. Our staff were over the moon. So but we've been working really hard. We never stopped working. We never closed our doors like so many other organizations and across the state, that we really tried to be here for this community throughout this whole challenging past year.
So Wendy or Rebecca, could you all put your email in the chat, so we can, if our returns want to send a note of thanks, they can. Is an email sent to? Yeah.
Yep.
So yeah, we'll that way we can send our note of appreciation for you and your staff. Perfect. So another question I have, just out of curiosity, with what are the warning signs for somebody who's we're all facing a lot of pressure for sure, our family and friends, and what are the warning signs that gets to the point where professional help needs to be sought?
I think when you realize that you don't have the energy to do what you need to do, when you get to a point where your worries are interfering with your ability to do what you need to do, whether that's work related, school related, home related. If I can't keep up with anything that I normally would do, I should probably be seeking professional help. Now, we all have little blips, a couple of days, a weekend where we go, I just can't do it and I'm just going to give it up. But if that goes on for more than a week or two, it's probably time to reach out. When you start seeing your worry or your exhaustion or your fatigue interfering with your ability to get things done, whether that's family related or school related or work related, or your other commitments that you might have, things like Rotary, if you just don't feel like you've got it anymore and that persists for more than a week or two, that's usually the sign that it's probably time to get a little help so that it doesn't get worse, so that help is short-lived and you can get back on your feet and start moving again. Because the longer we let those things go on, the deeper we dig that pit of despair, the harder it is to climb back out, right? It's hard to get out of a hole that's 3 feet deep, but it's really hard to get out of a hole that's 9 feet deep.
Very good.
So one of the, I was just going to comment that kind of a strategy, a way to work out is to call on your friends, those that are close, and really strengthen those networks, because it's those people, whether it's family or friends, that really are your safety net. And I've seen it before, and I felt it. Just encourage yourself to take a step outside the door, like you mentioned, get up out of the chair and reach out to people. People, I think, are reaching out less, and we need to reach out more at this time.
I think we do. And it's okay to say, John, you're not looking great today. How are you feeling? And if you see somebody that is struggling, acknowledging it sometimes opens the door for them to talk about it. And oftentimes, we suffer in silence, and it doesn't actually help anyone to suffer in silence. And, culturally, we have some generations that are more likely to try to, pull themselves up by the bootstraps and manage it themselves. And again, they're often the ones who end up in that 9-foot hole. But if somebody can see the signs and say, gosh, Kathy, you usually have more spring in your step. What's going on? It goes a long way to opening that door and making people feel like they're not in this alone.
Any other questions from our Rotarians? So Rebecca and Wendy, great presentation. It's very much appreciative, and we appreciate hearing from you on how we can support your organization. So I'd like to encourage my Rotarians to send Wendy or Rebecca an email expressing gratitude that they'll read out Tuesday to their staff, and there's a pat on the back for all the great work they're doing. Undoubtedly, they're taxed during this time. And our Rotarian group has got a lot of great things happening, with Norm and the auction, going live 1 week from today. So that's great. If you have more gifts that you want to put up, you know, you can reach out to Norm or Kathy to put that up. And, you know, the flyer is ready, and that'll be going out to everybody. So, you know, send that out to your family and friends and anybody else you know to get the bids coming in. And, you know, we're off to a good start on $10,000, and hopefully that'll double with the publicity and the people, you know, putting up the money. And Steve with his landscape service project. So with the Boys and Girls Club, it's great stuff happening. So plenty of opportunities for us to help contribute back to our community. So with that ado, I'd like to close the meeting, and appreciate everybody's attendance today.